Now we will begin today's webinar on Medicaid 101 and other government benefits. My name is Madison McMahon Ward, and it is my pleasure to introduce today's speaker, Joanna Morales. Joanna Morales is a cancer rights attorney and the co-founder and CEO of Triage Cancer. Ms. Morales has spent more than 30 years working in the cancer community, including as an adjunct professor of law at Loyola Law School, teaching cancer rights law, and for the John Wayne Cancer Institute Psychosocial Care Program. Ms. Morales has presented nearly 1,000 seminars on employment, insurance, finances, and advocacy, and she co-authored a book for the American Bar Association called Cancer Rights Law, an Interdisciplinary Approach. If you have any questions for Joanna throughout the presentation, please write those in the Q&A box. And with that, I'd like to turn it over to Joanna.
Thank you, Madison. So today's presentation is going to cover an overview of Medicaid, and some of the other government-sponsored benefits that we think could be beneficial to someone dealing with a cancer diagnosis. And so we're going to talk about Medicaid and how it interacts with Medicare and some other types of insurance. I'm going to talk about Supplemental Security Income, and then some of the other assistance programs that come from federal and state-sponsored benefits. So starting with health insurance, in the United States, there's really only 3 places where we get our health insurance coverage. We're either getting it directly from the insurance companies, we're getting it through our employer, but we could also potentially get health insurance coverage through the government. And that certainly includes Medicaid and Medicare, as well as military and veterans plans, state and local programs like high-risk pools. Now, Medicaid is a federal program that was created in 1965, along with Medicare. And Medicaid and Medicare often get confused, but they are 2 separate programs. And Medicaid provides health insurance coverage for individuals with low income levels and for other categories of eligibility. But when you think about Medicaid and the Children's Health Insurance Program, which covers children across the country through Medicaid, 83 million people receive health insurance coverage through Medicaid and CHIP. And that's about 25% of people in the United States. So it's actually a huge program. And while it is a federal program, it's only partially funded by the federal government and it's partially funded by states. So there's a partnership in funding, but states also run the Medicaid program for their state. And unfortunately, when we're talking about Medicaid, Medicaid is very, very, very state specific. And I say this at the beginning of the presentation because I'm going to give you an introduction to the things that are applicable to every state or identify where there might be differences among states and show you where to go to find the information for your state specific information. So I guarantee you at least one point during today's presentation, I will say something and you might think, well, that's not how it works in my state. And that's not at all surprising because states administer their own programs. And while the federal government creates some ground rules that every state has to comply with, states are allowed to have flexibility in how they design their Medicaid programs. And I'm going to give you examples of how that is. But states can also apply for waivers from the federal government to customize their programs. The problem is that creates a lot of disparity across the country in how people are accessing care through the Medicaid program. And it creates a whole lot of problems related to navigation, both for individuals who are trying to get health insurance coverage through Medicaid, but also for us as advocates in trying to help people navigate the Medicaid program. So there's not necessarily a solution for that, but I want to address it up front. Now, I mentioned Medicaid is very state specific, even down to the name of the Medicaid program. So many states actually call Medicaid the medical assistance program But then some states have way more entertaining names, like in Connecticut, it's called Husky Health, or in Wisconsin, it's called Badger Care. So it's important for you to understand that your Medicaid program might be called something different in your state and to recognize that as the Medicaid program. Now, prior to January 1st of 2014, Medicaid was only available to individuals who had a low income level, a low resource level, meaning your assets, and you had to meet some other category of eligibility. So there were these different doors into the Medicaid program. Most of the time, someone with a cancer diagnosis could only get access to the door on the left, which is referred to as the Aged, Blind, and Disabled program, which I know is a horrible name for a program. But effectively, it was available for individuals with seniors and disabilities, so people who are qualifying for SSI and then getting access to Medicaid. And it turns out those were a lot of hoops for people to jump through to get access to health insurance coverage with a cancer diagnosis. Now, excuse me. The different doors have different eligibility requirements. So for children or people with minor children, they might get access to Medicaid through the Children's Health Insurance Program. The door that was specific to individuals with breast or cervical cancer was created through a specific program at the CDC that led to breast and cervical cancer screening, as well as treatment through the Medicaid programs in each state. And then the states also have these very, very state-specific doors where individuals who have disabilities who are working could potentially get access to Medicaid at a higher income level through a buy-in program. Some states have medically needy Medicaid where people would have to pay a share of cost to get access to Medicaid. So I'm not going to focus on these state-specific doors today, but I want you to recognize that that might be an option in your state. And as I mentioned, every single door has a different income requirement. And you can actually find your state's income requirements online at healthcare.gov. And this is just an example of California. So the CHIP program is at 266% of the federal poverty level, where pregnant women are at 213%. And these numbers are a tiny bit out of date because California has passed some new laws to provide some new protections and lower costs for certain groups of individuals. Now, then along came the Affordable Care Act in 2014, and it created a new door into the Medicaid program. And that new door is for individuals with a household income up to 138% of the federal poverty level. And so for this year, that's $18,754. So if you make under that amount, then you could get access to Medicaid in your state. It's just based on income. They're not looking at your resources or assets. But then the Supreme Court got their hands on the Affordable Care Act, and in a Supreme Court decision, they made this new door voluntary for states. So states could choose whether or not to expand their Medicaid programs. All of the old doors still exist that look at both income and resources, but just the new door focused on the lower income level. As of today, the states on the left have chosen to expand access to their Medicaid programs, and the states on the right have chosen not to. And you'll see all those footnotes at the bottom are states that since January 1st of 2014 have expanded their program to provide this coverage to people in their state. And so these changes have happened as a result of new governors or new state legislatures who have been making different decisions about the Medicaid program. I will say that this is a slide that changes pretty often based on what those states are doing. So for right now, I think North Carolina is probably one of the states that's closest to making a decision about potentially expanding Medicaid coverage. So if you're in North Carolina, you might want to engage in some legislative advocacy. So this is an opportunity to work in your state to ensure that people have access to Medicaid through this new door. A lot of times when I'm talking about Medicaid expansion, people will say to me, well, I have employer-sponsored coverage. Why do I care about whether or not my state expanded Medicaid? And I think it's important to keep in mind that Medicaid covers some of our most vulnerable populations, like seniors and children and people with disabilities, but it also covers a lot of people who have jobs that don't offer health insurance coverage. We also know there's some good data that shows that Medicaid is good for our financial health, both of our state and the federal government, but also of individuals. So for example, we know that in states that have expanded Medicaid, the cost for private health insurance coverage through the marketplace is actually lower across the board. We also know that states that didn't expand Medicaid have higher rates of uncompensated care for hospitals. So when someone doesn't have health insurance coverage and goes to the emergency room to get medical care, and then they can't afford to pay for that care, the hospitals end up footing that bill. And that's referred to as uncompensated care. And unfortunately, uncompensated care is a burden for hospitals. And so hospitals may decide to close their emergency rooms because it's too expensive to keep open, or they might close the whole hospital. And we know that over the last decade, more than 100 hospitals have closed across the country because of those costs of uncompensated care. So sometimes we think about these policy decisions about, like, do we expand Medicaid in a vacuum without really understanding the domino effect that it could have on other aspects of our healthcare system. And then we also know that individuals who are in states that did expand Medicaid, the overall financial health of individuals in those states is better because they're not burdened with medical debt that they couldn't pay for because they didn't have access to health insurance coverage. Now, when looking at Medicaid as a whole, Medicaid has two types of payment systems. There's the fee-for-service system, where you go to a provider who accepts Medicaid, and that provider is paid directly for your care. Then there is also a Medicaid managed care model, which is like a health maintenance organization or an HMO, where you go to a specific group of providers and Medicaid will pay those specific providers. And so states could have one of these models, both of these models, or even at the county level, you might have one or both of these models. So your state might require that you only get access to Medicaid through a managed care model. Some states only have fee-for-service and some states have both. So then the question becomes, well, if Medicaid has these two payment systems, what does an individual who has Medicaid coverage actually pay for that coverage? And unfortunately, again, it's going to be state specific. So states are allowed to charge certain premiums and sometimes even enrollment fees on different groups of populations who are getting access to Medicaid. So this slide lays out the populations, but again, this is something that you can easily find from your state Medicaid program about what premiums you might pay based on how you qualify for Medicaid. You might also have out-of-pocket costs if you have Medicaid. So for example, if you have been prescribed a prescription drug, when you go and get that drug from the pharmacy, do you have to pay a copayment, like a fixed dollar amount that you would pay to get access to that drug? Or do you even have to pay a co-insurance amount, which might be a percentage of that drug cost? So again, the amounts that you actually pay are going to depend on the state that you live in and how you're accessing Medicaid. But it's important to understand that Medicaid isn't entirely free. You might be faced with paying that premium, and you might also have out-of-pocket costs, even if you get access to Medicaid. Now, I mentioned that the federal government creates ground rules where every Medicaid program has to provide certain things. And that includes what the Medicaid program is going to cover in terms of medical care. So these are the things that Medicaid has to cover: inpatient hospital care, outpatient services where you're visiting a doctor's office, labs and x-rays and transportation to medical care, family planning services. Those are all things that have to be covered by every Medicaid program. They might do it in slightly different ways, but every Medicaid program has to cover these benefits. For example, in the Affordable Care Act, there was a requirement that all private insurance plans cover the routine costs of clinical trials. And the routine costs are things that are included in standard of care. So things like doctor's visits and blood work and imaging scans. Generally speaking, it's all the things that would have been included in routine care, except for the thing being tested in the clinical trial. And that's usually paid for by the trial. So it really tried to eliminate some of the burden on patients who want to participate in clinical trials. Unfortunately, this protection only applied to most individual and employer plans. It did not apply to government-sponsored health insurance programs. Medicare and military and veterans plans were already required to cover routine costs under different legal protections. As of January 1st of this year, all state Medicaid programs now have to cover the routine costs of participating in clinical trials. So that's a huge benefit that the advocacy community was actually working towards to make sure that people on Medicaid didn't have to pay for routine costs out of pocket. So I see that there was a question about which private insurance plans were excluded from that ACA protection. That protection does not apply to grandfathered health insurance plans. So plans that existed prior to March, excuse me, prior to the ACA being passed. So another example of a required program covered by Medicaid are long-term services and supports. So Medicaid is actually the primary payer for long-term care nationally. Most people are not proactively buying long-term care insurance in the United States. And unfortunately, most people don't realize that health insurance coverage doesn't actually cover your care in a nursing home. You have to buy a separate policy for long-term care to cover the cost of being in a nursing home or having other types of long-term care services. And so what often happens for people is that they end up having to spend down their savings and their other assets, and then they qualify for Medicaid. And then Medicaid will pay for that long-term care. So there's been a lot of conversation around this at the federal level about how to create long-term care insurance for the country that you would buy into, but nothing has kind of progressed in that area. The challenge with qualifying for Medicaid for long-term care is that Medicaid could recover the cost of paying for that long-term care from your estate after you pass away. So there are some very specific rules around Medicaid estate recovery. So it generally applies to individuals who are over the age of 55, who are receiving long-term care. The state is actually required to cover the cost of those payments from your estate. States also have the option to recover the cost of other Medicaid services that you're receiving, but they're not required to do that. And so every state handles Medicaid estate recovery differently and also has exceptions. So if you have family members who are still alive and living in your home, they take all of that into consideration. And so we have the details about Medicaid estate recovery for each state in two places. We have it in our Paying for Long-Term Care module on cancerfinances.org. And then we also have that information on our chart of state laws. So you can look up the details for estate recovery in your state specifically. So besides the things that Medicaid has to cover, there are things that Medicaid may cover. And this is a list of all the optional benefits that Medicaid is allowed to include in their coverage. And so states approach these things all differently. Surprisingly, prescription drugs is on the list of things that Medicaid may cover. Fortunately, there aren't any states that currently don't cover prescription drugs. Dental care is one of those benefits that we often see fall by the wayside when states are in a budget crisis. So sometimes states are offering dental services through Medicaid programs, and then maybe 5 years later, they're not. So this is something to pay attention to, and it's something to advocate for. One example of an optional benefit that we find particularly useful in the cancer community is the health insurance premium payment program. When someone is eligible for Medicaid based on their income level or maybe their resources or other category of eligibility, but they also have access to group health insurance coverage through an employer. For example, COBRA coverage. But they qualify for Medicaid in their state, Medicaid will actually pay the monthly premium for that health insurance rather than pay for all of that care through the state Medicaid program. So they actually do a financial assessment to say, is it cheaper for the state to just pay their monthly premium for their COBRA coverage or pay for all of their care through our state Medicaid program? So this is actually a huge benefit to help people pay COBRA premiums or other types of group health insurance coverage if someone is eligible for Medicaid. So about 31 states currently offer this benefit. We do have the full list on our chart of state laws. One other type of benefit that is optional, so it's not in every state Medicaid program, is providing in-home support services. When we are talking about caregivers who need to take time off work because they are caregiving for someone, there are really limited benefits to replace those lost wages for someone who isn't working. A handful of states provide state paid leave for caregivers, but one other way to kind of replace some lost wages are through state in-home support services. So this is an optional Medicaid program where Medicaid is doing an assessment of an individual who has Medicaid to see if they need in-home help. Do they need help with activities of daily living? Do they need help with grocery shopping? And so after the assessment, someone is given money to provide or access those support services. Sometimes a family member can be the one to provide those services and get paid by the state Medicaid program to provide those services. So it's something a family member was going to do anyway, but could potentially get reimbursed through the state Medicaid program to do that. And that helps offset some of those lost wages. Again, this is not a benefit that's available in every state. So we do have this information on our chart of state laws. Some states don't allow family members to get paid to provide the caregiving services, and some do. And we've tracked that information on our website. And I'll just say, I'm seeing a lot of questions pop up in the chat, but I am not monitoring the chat for questions. So if you have substantive questions, please put that in the Q&A box, and I'll be able to answer those questions throughout and then again at the end of the presentation. So then the question becomes, well, when do you actually apply for Medicaid and how do you go about doing that? Medicaid applications are accepted year-round. So as soon as someone thinks they're eligible for Medicaid, they can apply right away. And there are two ways that someone can do that. Someone can actually apply through their state marketplace. You can always start at healthcare.gov, which is the federal marketplace. And if you happen to be in a state that runs its own marketplace, it will kick you over to that website. But you can also apply directly with a state Medicaid agency. And on our state resources page, we have the contact information for all of the state Medicaid agencies. When you apply for Medicaid coverage, the coverage is either going to be effective on the date of application or back to the first day of the month that you apply. Medicaid also allows states to pay for up to 3 months of retroactive coverage if someone would have been eligible for those previous 3 months. So this is actually really beneficial because if someone is in an emergency situation or has been diagnosed with cancer, they can start receiving care right away. And often hospitals will help someone apply for Medicaid coverage, and any care that they've received for the previous 3 months or until their application is approved will be covered by Medicaid. Now, unfortunately, some states have chosen to drop that retroactive coverage. Some states have chosen to do that for specific Medicaid populations, and then a handful of states have actually chosen to do that for all populations. We do have this information again on our chart of state laws. Medicaid coverage is going to end at the end of the month when a person is no longer eligible. So if someone has Medicaid coverage and is denied care for a particular service or surgery or a prescription drug, it's very important for someone to appeal that decision and to not take no for an answer. And filing appeals is one of our soapbox issues. I think a lot of times people accept that no as an answer and don't get access to the care that's been prescribed by their healthcare team. And so going through the appeals process is very important. Unfortunately, it's a little less consumer friendly for Medicaid than it is for other types of insurance. So with Medicaid appeals, someone has to request a fair hearing, and that's a process where you need to make sure that you're following the timelines that have been laid out and the steps that are laid out to actually get access to that fair hearing. So there are a lot of legal aid organizations locally that handle Medicaid or government benefits that help with the fair hearing process. And you can find that information on our state resources page. But once you've filed the fair hearing, there's really 2 paths that someone might go down depending on how they're accessing Medicaid. So if someone is in fee-for-service Medicaid, they're going to take a different path than if someone had a Medicaid managed care plan. The steps might be different and specific to the county where you live. We do have a module on appeals on cancerfinances.org. It breaks down the appeals process based on the type of health insurance coverage that you have. Now, I mentioned that Medicare is the other federal health insurance program that was created in 1965 along with Medicaid. Medicare is available to individuals who are 65 or older and eligible for Social Security retirement benefits, or for someone who has been receiving Social Security disability insurance for 2 years, or for anyone who has end-stage renal disease or ALS. Medicare.gov is actually a useful resource in understanding Medicare benefits, but we also have a large number of resources to navigate Medicare on the health insurance topics page on our website. But I bring up Medicare now to talk a little bit about how it interacts with Medicaid, because someone might be eligible both for Medicare and Medicaid. In fact, there are about 11 million people in the United States that are what we would call dual eligible. So they're eligible for both programs. Medicare typically acts as the first payer. So Medicare is going to pay first for medical expenses, and then Medicaid will pick up any cost sharing for Part A and Part B. Medicaid also covers things that Medicare doesn't. So for example, if you're in a state that has Medicaid dental coverage, Medicare doesn't cover dental coverage. So it can actually provide additional benefits that aren't covered by Medicare at all. So if you're trying to figure out how to navigate Medicaid in your state, that should primarily start with your state Medicaid agency. They're going to have the information about the Medicaid eligibility in your state, the coverage and what services are specific to your state, how to file Medicaid claims, even practical things like if you've lost your Medicaid card, how do you get a replacement? If you're looking for providers that accept Medicaid in your state, this is also where you would start. And once you apply, if you're wanting to understand the status of an application, this is also who would have the answers to those questions. So we do have the contact information for all of the state Medicaid agencies on our state resources page. Now, I want to briefly talk about how Medicaid interacts with other types of options. The Affordable Care Act, in addition to creating a new door into the Medicaid program, also created state health insurance marketplaces. And these marketplaces are effectively insurance shopping malls. And there are some benefits to actually buying coverage through the marketplace, like getting access to financial assistance. And that financial assistance can lower your monthly premiums through tax credits or lower your out-of-pocket costs through cost-sharing subsidies. Now, I'm not going to go into all the details of the marketplaces, but I wanted to show you what it looks like financially and how it interacts with Medicaid. So if you're in a state that has expanded Medicaid, if you have a household income up to 138% of the federal poverty level, you have access to Medicaid in your state. If you're between 138 and 250% of the federal poverty level, you have access to both the premium tax credits and the cost sharing subsidies. And if you're between 138 and 400% of the federal poverty level, you have access to just the premium the premium tax credits. Now, in a state that doesn't expand Medicaid, you lose access to that Medicaid option if you're between 100 and 138% of the federal poverty level. But the cost sharing subsidies do drop down to 100%, which isn't all that useful because it's the premium tax credits which actually lower what you pay for the policy. The cost sharing subsidies just give you discounts once you have the policy. So if you're not getting any financial help to actually get the policy, it's less helpful to have a discount once you do have the policy. So unfortunately, that Supreme Court decision created a disparity or a gap in coverage in states that chose not to expand Medicaid, where you have someone at 110% of the federal poverty level not getting access to help buying insurance, and someone at 350% of the federal poverty level getting help to buy insurance. And so the ACA just didn't anticipate that because the ACA had Medicaid in that gap. I do just want to mention for this year specifically, under the American Rescue Plan Act that was passed last year, there is a new benefit. For anyone between 138 and 150% of the federal poverty level, there are additional financial assistance options available where most people between 138 and 150% can get a plan on the marketplace less than $10 a month. So many people think about the marketplace as something that's more expensive, but for people who aren't qualifying for Medicaid because their income is right above what it is to qualify for Medicaid in their state, might actually be able to get a marketplace plan for very little money per month. And so this is something to understand and to know as an option for someone who isn't qualifying for Medicaid. I will also just mention that they added financial assistance at the high end as well, based on what it costs someone to actually buy health insurance compared to their household income. So for someone who's over 400% of the federal poverty level, they will give discounts so that health insurance doesn't cost more than 8.5% of their household income. But these new benefits only exist through the end of this year. We don't know what next year is going to look like yet because the law that Congress passed only goes through the end of this year. So I'm actually going to skip these two scenarios, but those are actually in a blog. So if you want information on moving states when you have Medicaid coverage, you can find that on our blog at triagecancer.org/blog. So I want to give you an example. Mark has cancer and was let go from his job last week. He's 24 and he lives in Illinois. And his annual income before losing his job was $30,000. He had health insurance at work, but he wants to know what his health insurance options are now. So because we have these new options available, Mark has a number of lanes that he can drive down after losing his employer-sponsored coverage. So he might be eligible for COBRA or a state COBRA plan. He could also potentially get a marketplace plan through a special enrollment period. He might have access to another group health insurance plan, like perhaps his parents, because he's under the age of 26, so he can move back to his parents' health insurance plan. Or he might be eligible for Medicaid or potentially Medicare. So based on his situation and his income level, he has a number of options that might be available to him. And we think it's really important for people to understand all of their health insurance options so that they can pick the best option for them. So turning to disability insurance, there are two federal long-term disability insurance programs that are run by the Social Security Administration. One is Social Security Disability Insurance, or SSDI, and then there is Supplemental Security Income, or SSI. For the purposes of today, I'm just going to focus on SSI. So both of these programs have the very same high standard of disability. And every law and program that we talk about has a different standard of disability. The Social Security Administration looks at disability as something that prevents you from doing your current job, really any job that you've had for the last 15 years, and that is expected to last at least a year or longer. And so that's an incredibly high standard of disability. And I often think sometimes that it's surprising that anyone can ever meet that definition. Similar to Medicaid, SSI is a program that is a federal program, but it's administered at the state level through a state agency called the Disability Determination Services Agency. And so again, this is a place where we see some differences across the country, even though it's the same federal program. Now, SSI is the program that is specifically for individuals who have a low income level, a low resource level, and they meet another category of eligibility, in this case, having a disability. And so what does that sound like? It sounds like Medicaid. So the same low income, the same low resource level, and in this case, someone has a disability that's keeping them from being able to work. Now, SSI is a cash payment. That's the benefit that you're getting from SSI. And the maximum federal amount for individuals who are not blind in 2022 is $841 a month. A handful, well, not a handful of states, some states actually provide supplemental payments to that $841 a month. But even California, which has one of the highest amounts, is only $971 a month this year. So we're not talking about a huge amount more that states are adding onto that base federal amount. Because the application process can actually take a while, SSI will actually pay back payments. And back payments will cover the months from someone being approved to the date that someone applied, if they decide that someone's disability existed at the date of application or before. So it takes a while to get approved, but you might be owed for those months that it takes to get approved. Because the low income and low resource levels are the same for Medicaid, in most states, once someone is approved for SSI, they automatically get approved for Medicaid in their state, except for the 9 states listed at the bottom of the slide. So these programs often go hand in hand for someone who has a disability. Now, when we're talking about what counts as income and what counts as resources, there are important details. And there is a math formula to do this. So when we're talking about earned income, like you have a job and you're earning income, the wages are counted as income, but there is a $65 disregard, and then they only count half of earned income after that. But then there's also unearned income. So that could include pensions or Social Security benefits or dividends. Those all include unearned income. But the thing that I want to stress here is that there is also something called in-kind support and maintenance. And this is where people get tripped up quite a bit. So I had talked to a young adult a number of years ago who had been diagnosed with cancer and moved back in with his parents while he was in treatment. And SSI counted the free rent that he was receiving from his parents as in-kind support and maintenance. So it actually ended up lowering his SSI payment because they counted that free rent as in-kind support and maintenance and including that in his income level. So this is something to keep in mind when figuring out if you qualify for SSI. And then certain assets don't count as resources. So the home that you live in, one vehicle, if you've paid for a burial plot, all of those things are not included in resources. But if you have a vacation property, that's going to be considered a resource. It's very important that you understand that you can't transfer your assets to someone else because they actually look at your finances back 36 months. And if they determine that you've transferred resources to qualify for these programs, you could be ineligible for the programs up to 3 years into the future. So it's important to understand that these are very strict income rules that really haven't changed for quite a while. So unfortunately, that $2,000 resource limit for an individual and $3,000 for a couple has been stagnant for at least the 20 years that I've been doing this work. And it is something that advocates have been trying to change for quite a while in Congress, but haven't been successful yet. So we do have quite a few resources to help people navigate disability insurance, both for SSI and SSDI. So I would just point you to our disability insurance topics page to find those resources to be able to learn more about this topic. So turning to some of the other programs that provide financial assistance from the government, we always encourage people to think as creatively as possible about financial assistance, because sometimes when someone has an emergency financial need, people are very focused on that specific need. Like they have a medical bill that they can't pay, they're looking for financial assistance that helps pay medical bills, as opposed to thinking about utilities assistance that could help offset the cost of their utilities so they could shift that money to somewhere else. So we encourage people to think as creatively as possible, because sometimes in a crisis, sometimes people have blinders on and aren't thinking strategically or creatively about all the things that could be helpful. So at cancerfinances.org, there's actually 3 places where we share financial assistance information. We have our financial assistance resources module, which have resources on a wide variety of programs and services. But then we also have an entire module that focuses on managing the cost of prescription drugs. And then we also have a module that focuses on COVID-19 that includes many of the financial assistance programs that were created as a result of COVID that may also be very beneficial to someone dealing with a serious medical condition like a cancer diagnosis. And then if someone is in a situation where they have lost their job, there are also government provided unemployment benefits that are funded both at the federal and state level, but they are administered at the state level. So we have details about every state's unemployment benefits on our chart of state laws, which tells you the maximum unemployment benefit that you could receive in that state, as well as the contact information for the unemployment benefit agency in your state on our state resources page. And then another cash benefit that exists at the federal level is temporary assistance for needy families, also known as TANF. And TANF is often referred to as general assistance, where families are getting access to cash benefits to pay for expenses. It's also important to realize that a lot of these benefits are tied together. So if you qualify for SSI, you're likely to be eligible for Medicaid. If you get SNAP benefits, you might also get TANF automatically in your state. So sometimes applying for one of these programs can actually trigger your eligibility and automatic enrollment in other benefits as well. So for someone who needs access to food assistance, there are a number of programs created at the federal level. If you or someone you know is hungry right now, there is a hunger hotline that exists that can help people get access to food in their communities, but certainly there are organizations like Feeding America, which can provide information on how to find food locally. But then there's also the Supplemental Nutrition Assistance Program, also known as SNAP or food stamps, that helps people monthly with getting access to nutritious food. There's also the WIC program, which is specifically for women and children. And then there are also programs specifically for children to provide meals at school or childcare centers, and seniors to get access to nutritious foods at home. And so we want to make sure that people are getting access to the food that they need. There are also a number of housing programs. They exist both for renting as well as mortgage programs, but I've highlighted just some of the rental assistance programs here. The U.S. Department of Housing and Urban Development is the federal agency that provides these programs. So if you wanted more information about mortgage-specific programs, you could find that there as well. But there are actually different ways to get access to rental help. A lot of people are familiar with Section 8, which are actually vouchers to help someone pay for all or part of their rent. But there are also actually public housing where you can apply for a spot in those public housing facilities, or you could get access to rent help to live at a privately owned apartment as well. And so if you are looking for housing assistance, you can also contact a HUD counseling agency, which will walk you through your eligibility for these programs and help you apply. And then there are a couple of utility assistance programs. One people are probably more familiar with, which is LIHEAP, which is the Low Income Home Energy Assistance Program to help with heating electricity costs for low income households. But there is also a brand new program for water as well. And so I'm not sure how you would say that acronym, it's so new, but LIWAP maybe, but it's the Low Income Household Water Assistance Program. And that is also available through the U.S. Department of Health and Human Services. And then there are federal programs that provide phone and internet assistance that people may be less familiar with. There is the Lifeline program, which provides phone service, which you can apply for at lifelinesupport.org. And then there's also the Affordable Connectivity Program, which is run by the Federal Communications Commission, or the FCC, which offers broadband internet for low-income households, as well as a one-time discount to buy equipment to get access to the internet. So that's available through the FCC. And I do just want to mention this last program because I think it's pretty relevant for the time that we're in. But as a result of COVID, there was a federal funeral assistance program created that provides up to $9,000 to reimburse someone for the costs of a funeral. And this is run through FEMA, or the Federal Emergency Management Agency. And if you have a family member who died of COVID, they'll reimburse you for those costs. And it's actually a pretty underutilized program. But funerals are incredibly expensive. And so if someone you know actually qualifies for this program, this could be very helpful to recover those costs. I also want to encourage everyone with respect to government benefits and programs to use your resources. And one resource that people don't think of are elected officials. And so if you're trying to get assistance with a state program, your state elected officials, or if you're looking at a federal program that you're trying to get access to, your members of Congress are incredibly useful in this process because they actually have staff assigned to help their constituents navigate these programs. And so I think we often forget about them as a resource, but they do exist for that reason. So I encourage people to utilize their elected officials to get help navigating these programs. And if you don't know how to find your elected officials, we can help you do that on our advocacy topics page. The one last thing that I want to mention, sort of as a thought, food for thought, is that crowdfunding is a way that many people are trying to get help covering the cost of their expenses as a result of a cancer diagnosis. And they're incredibly useful ways to help cover those costs. Unfortunately, it might impact someone's income level and qualifying for all the programs we've just been talking about. So we would never want someone to go through the crowdfunding process and then find out that the income that they've raised has actually kicked them off Medicaid or SSI or one of the other government programs available. And so there are some ways to set up crowdfunding properly so that it doesn't negatively impact someone's access to these government benefits. And we cover crowdfunding platforms and how to set up them appropriately on our quick guide to crowdfunding. So I just wanted to leave that as a last thought for today.